We are doing a presentation on art therapy, and we actually made a website for our presentation, so if you guys want to follow along, the website is rpse505.webs.com. Alright, so art therapy is a type of therapy that focuses on exploring inner feelings, thoughts, emotions, and ideas, and it can help people work through different issues that they are having, such as anxiety or depression. And the role of the therapist in this is not to tell the person who's exploring themselves what they should be feeling or what their art means, but kind of helps them explore it and helps them guide it through it and maybe gives them suggestions. So what the person does is they create a piece of art, and then afterwards they reflect both on the purpose or the process of making the art and how it felt, things that they thought about or images that they had in their head while they were creating it. And then after it's finished, they explore with the art therapist what was created, and they try to find meaning in the final product. And this meaning could be a past trauma, or it could be thoughts, feelings, or ideas that the person wasn't able to express with words. And that's what makes art therapy different than other types of therapy. Is the main form of, the main role of the art is communication. There's not words, it's the visual art that communicates from the client to the therapist. And this is really important for people who might not be able to talk, or maybe children who cannot express themselves. And it's just helpful for regular people who just aren't able to put into words what they are feeling or thinking. So then if you scroll down on this page, I also talk a little bit about goals of art therapy. So the goal of, there's a lot of different goals depending on what the client is trying to accomplish themselves, but things that get accomplished with all art therapy sessions are coping with stress and physical symptoms of a disease or disorder if they're present. And it also can help resolve conflicts and problems and develop interpersonal skills. So it's really good for people who don't have social skills or have social skills that they want to improve. And it also can help manage behavior, reduce stress, and increase self-awareness and self-esteem, because it is such a process that focuses so much on reflecting inward. People tend to find out a lot about themselves that they didn't know, or they are able to admit to themselves things that they weren't previously able to. And then there is a lot of different clientele that it can be used with, and that's also what makes art therapy so great, is it can be used with young children, elderly. It can also be done individually, or it can be done in group settings, so it's a good form of family therapy for some people who might not be able to verbally express tensions or situations that have happened within the family. And it also can be used to treat a large variety of different disabilities and disorders, anxiety, depression, mental illness. All of these different disorders can be helped by reflecting inwards towards a person. And it's also, a lot of the literature also talks about how it's not just for people with disorders or disabilities. It can be used for regular, well, they term them regular people who don't necessarily have a diagnosis, to just gain some more self-awareness and self-insight. And it's also really helpful, as I stated before, for school-age children who aren't able to verbally express themselves as well as, say, an adult would be able to. And also there's a lot of different settings that art therapy can happen in, which allows it to reach a larger basis of a larger population. It can be done in a clinical setting, but it also can be done in schools. It can be done in the person's home, hospitals, art studios, and making it this versatile makes it very accessible to a wide range of people. I also have a little bit on the website about who art therapists are, and this is helpful if you are interested in becoming an art therapist. But what's really interesting about art therapy is it combines both counseling and art. So people who are art therapists are artists, but they also are counselors, and they often do studies in human development and family relationships. And they use all of these different backgrounds to kind of come together and explore the individual's art and the process that they went through to make the art. And if you are interested in different careers of art therapy, there's a video on the website. And if you want to know what a session in art therapy looks like, there's also a tab under What is Art Therapy that has some different YouTube clips that go through what a few different people have done in their art therapy session and what they were able to discover about themselves. So that's it about what art therapy is. Next, we'll talk a little bit about its history.
So art therapy has actually been around since the caveman days. There have been different things that they have found to suggest that it has been around, but it wasn't until the 60s and 70s when it really started to become its own discipline and people actually started recognizing its value. Two of the early contributors in the field that are major, I wouldn't say, I guess opposites is a good word for it, are Margaret Naumburg and Edith Kramer, and then we'll be talking about Eleanor Ullman in a little bit as well. But Margaret Naumburg focused more on the psychoanalysis of art therapy, and she really stressed that it was symbolic speech, a way of communicating between the client and the therapist in a straight, direct manner, and she really stressed that. And she also stressed that art therapy is a primary therapy. It can be used as a primary therapy and not just an auxiliary therapy to other types of therapy. So just a picture of her. Scroll down a little bit to Edith Kramer, who also was developing art therapy at the time, but she more stressed the idea of sublimation, which is where the feelings of art come from, and it comes from within the person, and it kind of just spills out onto paper, whatever medium they're using, and then it's interpreted. And then she would use the Freudian psychoanalyst interpretations to figure out where all that came from the person. And then if you scroll down just a little bit more, oh, there's a video also of one of her art therapy sessions, which I found pretty interesting. It's about 15 minutes long, so if you want to give that a look, that's pretty cool too. Alright, and we also have Eleanor Ullman, who created a synthesis between Margaret Naumburg and Edith Kramer's ideas, and she looked at it as a means to discover both the self and the world, and to establish a relation between the two. So she doesn't really, as Edith Kramer more or less focuses on the quality of the art and art itself. She's looked at as more of an art education therapist. And then Margaret Naumburg looked more at the psychoanalysis behind it. And so she didn't focus on art really hardly at all. It was just kind of the mode of communication between the client and the therapist. Eleanor Ullman takes both of those and looks into the quality of the art and also the expression behind it, and also maybe the hidden meaning underneath it all. And then if you want to scroll down, there's just a brief, I've kind of already covered it, a brief I guess summary of what symbolic speech therapy would be, which is more of Margaret Naumburg's area that she developed, and then sublimation, which is Edith Kramer's ideas that she came up with, and then they both supported those. And then if you scroll down even more, it basically just says that these both combined really developed the whole field of art therapy. And then there's also a continuum that's included, just to make it a little bit easier to understand, where Kramer's on one end and Naumburg is on the other, and they both support the two different ideas of the art education and then the psychotherapy, and then Ullman's right in the middle, and she kind of takes both of them together. So most art therapists use those theories and kind of intertwine the two to really help develop their area or their ideologies behind their practice.
I'm going to talk about art therapy use with cognitive disabilities, and specifically on this site I'm going to talk about its use with depression and schizophrenia, but it's used in a lot of different ones. We're going to start off with depression, and it started with Susan Katz, and she was an art therapist, and she worked with a variety of patients for 6 years, and they all had depressive symptoms. And she uses two approaches, the non-directive and the directive. And the non-directive is pretty self-explanatory. She just told her patients to draw whatever came to their minds, and she was hoping that they would use their own decision-making skills to come up with something creative. And she was actually wrong in what she expected. She thought that their depressive symptoms would come out and that all of her drawings would be like morbid and dark, reflecting like their inner feelings. But actually the results were all full of color and life, and she asked them specifically what their inner feelings, like if they came out in their drawings, and they said no. They would rather draw things about the way they wish things were or the way things used to be before their depressive symptoms started showing. And then she was also wrong when she started with the directive approach, which is also self-explanatory. She gave them an idea or a theme to build around, and then they just drew around that. So she expected that when she told them specifically what to draw, the patients would withdraw and feel threatened by her. But the results were actually that giving the patients an idea of what to draw relieved them of the stress of thinking of something on their own. So they are actually more pleased with doing the directive as opposed to the non-directive, which she thought was really strange. And then if you scroll down a little bit, there was a case study done with depressive patients in prisons. And what the study did, it took 48 prison inmates, and they all had Axis 1 disorders. And they went through a 4 to 6 week therapy session. And if you read further in the study, it tells it like exactly what they drew. But it just talks about how in prison settings, they didn't expect art therapy to help the inmates as much as it does. And it goes into details about certain types of inmates and what their disorders really were.
Throughout my research, I found that through art therapy, you don't necessarily reduce physical limitations, but rather enhance any of the functions that the person does have left and really try to push their limitations to their full potential. One of the things that I looked at was a program called Art Express, and here they use adaptive equipment for people with physical disabilities in order to allow them to produce artwork and basically express their emotions. They felt that it was a life-enriching experience that really shouldn't be denied to anyone. One of the examples that they used was someone with cerebral palsy who doesn't have good hand grip or has spasms in their hands, and through their adaptive equipment they were able to still paint and create artwork in order to express their emotions. They really are success-oriented in the tasks that they pick out for each individual, depending on what they choose for them to do as far as artwork. And it's a multi-sensory approach for multiple different kinds of disabilities. One of the other things that I looked at, if you scroll down, was a news article from Tulsa World, and it just talked about people who had gone to physical therapy and had actually entered art therapy while they were there. And one of the women quoted in there was Melissa Dickerson, and she said, "I went for the physical therapy, but I stayed for the art every single time." And the article talked about how people with physical disabilities oftentimes were unable to work in their everyday lives. So through their artwork, they were able to actually sell the things that they had made, so they'd have a little cash on the side, so their budgets already were pretty tight, and that allowed them to live a more enjoyable life, like someone who doesn't have a disability, and not feel so restrained in everything that they do. I talked about how it allowed them to feel like they have a self-worth, and like the things that they were doing were meaningful. Coming to art therapy, the article talked about how it forced people to not have a pity party at home, and they got to come and enjoy themselves and interact with people and participate in activities that they might not have been able to on their own or in the past because of their limited function. One of the other things that I looked up was occupational therapy for physical dysfunction, because a lot of what they do is about helping the people get back to their normal functioning, but they do these things through puzzles and artwork and just little tasks that are success-oriented, just as art therapy is. And yeah, I guess it promotes successful performance for them. It restores confidence. It builds confidence in them. So yeah, below I have linked a YouTube video, and it talks about different physical dysfunctions that people have and how they use them with art therapy, and you can take a look at it, and it shows a lot of the different adaptive equipment that they use for people, whether it be paintbrushes they're able to use by moving their head, or painting with their feet and such things. So yes.
So as evidenced before, like early in the presentation, art therapy can be used for a variety of different populations, but one we haven't really focused on is eating disorders, so I'm going to focus more on that one. And then if you want to reference the website, there are a few different examples of other populations that it can be used for. So there was this documentary called Thin that I started watching about a group home for people who suffer with eating disorders, and it really focused on a woman named Shelley. And she had started struggling with eating disorders while she was in college, and this was 6 years later. So she'd been struggling for that long, and through the therapy and everything, she was able to really come down to the root of why that started, and where those feelings are coming from, of why her self-worth was so low and everything. And so yeah, the therapist just helped all the patients to process through their eating disorders. And yeah, so Shelley, I have a video that I'm going to show later, and in it, it just shows that analyzing the family dynamics, and she's a twin, so she had a lot of conflict between herself and her twin sister, and just a lot of competition between them, and it just wasn't very healthy. And so post-college, it just really started to affect Shelley, and she wanted to be thinner and prettier and everything than her twin. And so that was really where the root of it started. So it's just kind of cool to see that art therapy isn't just for physical disabilities or cognitive disabilities. It can really be used for any sort of population that, dealing with feelings, or people without disabilities, or anything like that.
Alright, thank you for watching our presentation on art therapy. I hope you found it informative. Feel free to check out our website. See you in class.